cardiac electrophysiologist Dr. Diedrich Clark is joining me now to share the importance of early intervention when it comes to atrial fibrillation. So available treatment options, how to reduce your risk, and of course those serious complications. So thank you so much for joining us today.
Thank you, ma'am. Good morning to you.
Yes, good morning. So first off, though, for people who might not know what it is, what exactly is atrial fibrillation and how common is it?
So atrial fibrillation, or AFib, is the most common arrhythmia in the United States. It is the most common arrhythmia in the world. 10 million Americans have atrial fibrillation, and that number is expected to climb over the next decade and up to 32% increase in the next decade. What AFib is a cardiac arrhythmia, meaning that the electrical impulses of the heart are abnormal. Specifically in AFib, you will go from having a normal heart rate in the upper chambers, typically at rest ranging from 60 to 90, then spontaneously your heart rate in the upper chambers are now going 300 to 500 beats a minute. 1 in 4 people over the age of 40 will be impacted by atrial fibrillation at some point in their lifetime.
Wow, I didn't realize how fast the heart could go. I mean, that's scary when you hear those numbers. So obviously very important to diagnose and treat AFib early, right? So talk about the importance of that.
Yes, ma'am. So atrial fibrillation is a progressive disease, which means that the longer you go untreated, the more likely that the ill effects, the symptoms, and the risk are going to perpetuate over time. Specifically, untreated atrial fibrillation is associated with a 5 times increased risk of heart failure, a 2.4 times increased risk of stroke, a 2 times increased risk of sudden death. And atrial fibrillation has also been shown, if left untreated, to have an impact on the progression of dementia as well, which is why it's critical, vital, that we undergo detection with symptoms and treatment as well.
Oh my gosh, that is so scary. So how is it treated?
So atrial fibrillation is treated with medications, typically as to start off with, sometimes called antiarrhythmics to try to control the rate and the rhythm. However, there's a procedure called catheter ablation or pulmonary vein isolation, which is a minimally invasive procedure that is designed to isolate the abnormal signals that is triggering AFib from the normal conduction of the system of the heart, thus allowing that normal system and that normal conduction to perpetuate. It is safe and effective, oftentimes done as an outpatient procedure. Like all procedures, there are risks affiliated with it that you can discuss with your physician.
And I have to ask, is this something that we can actually feel, like when the heart is beating really fast, and that's when maybe we should ask our doctors, or how do we know it's happening?
Ma'am, that's such a great question because, of course, the first thing is starts with the patient. Some of the symptoms of atrial fibrillation are palpitations or kind of your fast heart rate, but it could also be things such as dizziness or lightheadedness, fatigue. I feel short of breath when I exert myself. Some people describe, I just feel anxious. And some people, especially I see that in older population, will say, hey man, I'm just slowing down. I feel myself slowing down. When the reality is AFib that is propagating that. So anytime you have any of these type of symptoms, it is vitally important that you get treated and evaluated.
Well, I'm glad we're talking about this today then. So where can we go for more information on everything?
Yes, so Johnson & Johnson has comprehensive patient resources to not only further in our understanding about atrial fibrillation as we discussed, but there's a website called Get Smart About AFib, which is one word, getsmartaboutafib.com, that will not only give you personalized information, but will also see if you are a candidate for catheter ablation and put you in touch with an electrophysiologist in your region.
Wonderful. Well, thank you so much for telling us about this today. I had no idea.
Yes, ma'am. Thank you for the opportunity.
Of course. And everyone at home, if you would like to see this interview again, just head to First Coast News Plus.